Beach FM, locals talking to locals.
He's just phoned in, delightful to say that we can welcome now to the program the Mayor of the Kapiti Coast District Council, Mr. Gurunathan. Good morning and welcome to you, sir.
Good morning, John. Good morning to the listeners.
Lovely to talk to you. We've got to talk about COVID-19, don't we? It's just dominating discourse, and I imagine financial planning at the moment. I see Air New Zealand has just downgraded its financial forecast by 85%, and they've ceased trading. These are extraordinary times in which we live, aren't they?
Absolutely, and I can understand people's concern about their own jobs, the welfare, the health. So it's serious.
And what about the KCDC? I'll ask a question that I asked of the Horowhenua Mayor. Let's assume that this does get bad and that the council, that we are, for one reason or another, we're not allowed to congregate, get together. Is the KCDC in a position to carry on its work in a distributed fashion?
Well, put it this way. We need a central command system in terms of accurate and reliable information. So there is a command system where we are attached to. The Ministry of Health is the key leader in this.
Yes.
They're working very closely with the National Emergency Management Agency, which is the lead for welfare and civil emergencies. And through them, we have the regional emergency medicine office in Wellington. And so the command chain comes there, and we get daily, twice daily. It has been sort of every 3 days we get an update, but that is starting to increase. So I understand there's a lot of concern in the community, but it's important that we don't get ahead of the ministry and try to decide things independently.
Oh, no, and I'm not suggesting that. What I'm asking is, can you work from home? Let's just put it that way. Can the council work in a distributed fashion so people are working at home, they don't have to congregate in the event that for one reason or another we should not congregate?
Look, I think the key services that we need to be worrying about or paying for is getting a water supply going, the wastewater system is working, and the rubbish is collected. I mean, these are the key areas that we need to look after.
Yes.
And for some of these places, you cannot work from home. You need people to be working in the plant.
Indeed. So those frontline workers who, incidentally, could well be more exposed than others in the event of an emergency, which we certainly seem to be heading into. So I suppose as an employer, you would have some concerns there.
Plants. You know, there are workers in treatment plants, wastewater plants. I think they have, if your precautions are, you take the precautions pretty well. Washing your hands, all the hygienic. I think you'd be more or less safe in that area.
Yes, indeed.
It's where you're interfacing with people. And I come to the other point, the senior council staff for managing who should be able to work from home.
Okay. So, and we had an exercise on Saturday at the community centre, which basically was, it was helped out by Remo, but I understand that the Parapara Umu Raumati Community Board were instrumental in getting this going, and it was really the community getting together and examining various scenarios, various emergencies. And I asked the Remo representative whether Remo was involved in the COVID-19 situation, and it appears that they are, so that is part of the puzzle as well, isn't it?
Well, I mean, like I said, Remo is part and parcel of the command chain in terms of information dissemination. So, and at the end of the day, yes. I think, we are at the keep it out, stamp it up phase. It's vitally important that we stay calm, exercise the limitations, and show kindness and support for those around the community who are unwell or taking steps to protect themselves and others. But the key is actually doing the basic hygiene things and keeping unnecessary social gatherings, keeping away from those.
Indeed. And of course, if we have a look overseas, some of the measures are quite extraordinary. It's hard to imagine France with the restaurants closed down. And something that possibly has got an implication for New Zealand. The British government apparently are mulling over, asking those 70 and over to stay at home, not just for a fortnight or so, but for several months to isolate themselves, to protect themselves against that. Now, that could have a very real impact on a community such as the Kapiti coast, couldn't it?
That's right, because we have a large number of people who live, elderly people in single occupant homes. We have a large number of, last count I think it was 3,000. So this is where the community needs to know your neighbors, look after your neighbors. And there is mental health problems, anxiety will pick up.
Yes.
So that's why, at the end of the day, people need to be aware of your neighbors, talk to each other, be kind to each other, look after each other.
And this is where the work that's being done by your team to help build up resilient communities, the cuppa over the back fence type of idea.
That's right.
That's where this becomes really important, because that's where the networks have formed that can get us through.
Yeah, and I keep hammering for the last few years that we need to be beefing up our neighborhood support groups, and precisely for these things like this.
So do you think that we should have more support of the neighbourhood support movement in this area? Because frankly, it's been relatively absent of late. Yeah,
so this is it. I think we need a vision around this, that every street needs to be connected to the neighbourhood support group. And I like to see the community boards, and the message has gone down to them earlier this year itself. I think the community boards have got a very strong role in this.
Absolutely. Well, okay, we live in very interesting times, so your message is don't panic. We're getting quite strong leadership from central government at the moment, and the Ministry of Health, the lead agency in this, so we'll have to see what happens, but don't panic in the meantime. That seems to be what you're saying.
If people want information, get to the Ministry of Health website or call the helpline on 0800 358 5453.
Okay, Guru, thank you very much for joining us. Unexpected pleasure, but lovely to have you on the program all the same. Thank you so much.
Yes, fine.
There we are. That is Mayor Gurunathan.
106.3 Beach FM.